A lot of people don't know this, but you can get weight loss medications approved if you have other pre-existing conditions. For example, obstructive sleep apnea. Obstructive sleep apnea is a diagnosis that it is clinically acceptable in order for your provider to prescribe things like Zepbound. The other thing is heart disease. A lot of people don't know that heart disease is a clinically justifiable diagnosis in which you can get Wegovy covered by insurances like Medicare. And something else was just recently added on for Wegovy. Fatty liver. So fatty liver is another one for Wegovy in particular that you can get it approved if your provider prescribes it, and it should be covered by your insurance as well. So a lot of people don't know this, but I would say just make sure if your primary care provider is not willing to prescribe these things for you, because a lot of them are not comfortable or even savvy of just knowing which diagnosis codes to put to get these medications approved, go to a weight management specialist. There are clinics out there like ours that specializes in weight management. And so we know, and our providers know, which diagnoses are appropriate to get your weight loss medication approved through your insurance. Now, mind you, some of them have very particular guidelines. And so even though you have these diagnoses, some of them will just not, prescribe it to you, like Ambetter. Even though Ambetter has been surprising as of late, we've had some patients with obstructive sleep apnea get Zepbound approved through Ambetter. So it's really a hit or miss. Also, it's a hit or miss because it just depends. What I've noticed is just depends on the person who is evaluating that prior authorization for the medication. But it is worth a shot trying. If you can get the medication approved through your insurance is great. But you as a patient also advocate for yourself. So now that you know this information through this video, try to get your provider to prescribe it to you. And if you can't find a provider that will prescribe it to you properly, go to a weight management specialist that can do this for you, so that they can try and appeal and try to see if they can get it approved.